The Bayelsa Health Insurance Scheme, in partnership with UNICEF and GAVI, took a giant leap towards universal health coverage by enrolling 10,000 vulnerable Bayelsans into the health insurance scheme. This event brought together dignitaries and healthcare experts from across South region of Nigeria. Let's hear their insights on how this initiative will transform lives in Bayelsa.
Okay, sir, can you just introduce yourself?
Yeah, I'm Dr. Akifenwa Oyekola, the Bayelsa State Coordinator, National Health Insurance Authority.
Thank you very much, sir. So today we are witnessing an amazing event here in Bayelsa State, the enrollment of 10,000 vulnerable Bayelsans into the BHIS. So what do you think about this initiative?
Yeah, it's a welcome development because the challenge of expanding universal health coverage in most of the states is actually the informal sector. In the last estimate, about 83 million Nigerians are actually estimated to be multidimensionally poor. And in this state, we actually have a fair share of them. So the challenge is, what are you going to do to expand coverage when these people cannot actually afford the premium? And that's why we're encouraging, high net worth individuals, multinational companies, philanthropists to actually look into this area and copy this model by GAVI, UNICEF, by adopting persons in this vulnerable group. The government alone cannot do it. Thank you.
My name is Dr. Anselm Audu, Chief Field Office, UNICEF Port Harcourt.
So, could you elaborate on the specific roles the GAVI and the UNICEF has to play in the fulfillment of this initiative, sir?
Well, GAVI has supported UNICEF to provide this support to the state by providing the funding.
What challenges do you think one could envisage as this initiative goes on, and what measures has the GAVI and UNICEF put in place to address such challenges?
The Association of General Medical and General Medical Practitioners in Nigeria, they are asking government to increase the capitation being paid because of the inflation that is happening in the country. We are hoping that even with the inflation, the capitation that has been paid should be able to sustain the program for the next 1 year to ensure that the enrolled client will be able to receive the needed care during this period of 1 year. The issue is sustainability, but we want to do this as a test and show to the government.
My name is Josephine Ode. I am the South Regional Manager, United Healthcare International. We're actually third-party administrator, TPA for BHIS. We're very happy with this development. It's health insurance about universal health coverage, carrying almost everybody along, ensuring that everybody has access to healthcare. So we're happy about this GAVI, UNICEF, BHIS partnership. They've adopted 10,000 vulnerables. Those are people that can't even afford healthcare, like the poorest of the poor. And that's the way to go. Some people can't afford health insurance. It's not their fault. They can't help it. They don't have the economic means. So this partnership is really very key. And we hope that with time, they'll expand the scope of coverage, the scope of adoption. People that can't afford health insurance, those that can afford it can adopt them, take them over, and then pay for their health insurance. So it's very key. It's very key. Our dream is that all Bayelsans are covered by any means. If you're a civil servant, you are covered. If you're a businessman, you are covered. If you are self-employed, you are covered. If you can't even afford it, you're also covered. We always are on ground to ensure that the scheme succeeds, because that's our dream, that all Nigerians have access to quality, affordable healthcare at their fingertips, and cost. Money should not stop them.
Can you discuss the additional aim of improving the healthcare facility for 10,000 vulnerable people here in Bayelsa State?
Of course, improving the facility will go a long way to, shining light on the health insurance. When you have facilities working well, improved, people tend to come. If you don't improve the facility, people don't come. Health insurance is driven by word of mouth. When the health facilities are working, and then the people go there and get quality care, they will continue to come, and they will even pay to come, so that they will not suffer poverty at home because of ill health. And this will drive us closer to universal health coverage in no time. If we don't improve our facilities, even if we have all the lives in the world, where will you take them to? If you pay, if I adopt and they adopt, and all everybody buy lives, and we don't have facilities, what do you want to do with the life? Even if we pay, even if people pay money, if you have money and you have coverage, but you don't have facility, health insurance will not work.
Professor Brisibe, the Honorable Commissioner, Ministry of Health, Bayelsa State.
Commissioner for Health, I'm pretty sure Our Excellency, the Executive Governor of Bayelsa State, Senator Doizeri, must have given you a mandate for the healthcare of Bayelsans. What was the mandate, sir?
Yeah, the mandate one was to expand the Bayelsa Health Insurance Scheme towards having universal health coverage. And then number two was to upgrade the facilities. Now we have about 150-something thousand covered, both formal and informal sector. Hopefully, financing framework for our health infrastructures in the state, so to enable us take up all this, because if we insure them and we don't have the facilities to provide services, it's going to be a failure.
Thank you very much. My name is Dr. Ngowa Retona, and Director of Medical Services. I will say that for the Ministry of Health, under the leadership of Professor Brisibe, we have gone around a lot of health facilities, and we have seen the infrastructural gaps. And for you to have universal health coverage, of course, you cannot do that insurance. And apart from the insurance, you need to provide a befitting environment for the patients. And that is what we are doing. And I think the government is serious about it to ensure that our health facilities are brought to the level where it will be attractive for Bayelsans to go and seek healthcare service delivery.
Okay. Thank you so much, sir. Thank you for coming.
Good afternoon, sir. Thank you very much for this opportunity. Okay, sir, how would you describe this initiative that was launched today?
My name is Chief Dr. Apa Williams, the Executive Secretary of the Bayelsa State Primary Health Care Board. This initiative that was launched today, it's one of the most fantastic things that happen to healthcare, because there's no way we can talk healthy Bayelsa without talking healthy insurance or insurance uptake. Now, it's a good step in the right direction, and we want to encourage everybody to key in. You don't need to have the millions to do so. You can just have a few persons to adopt, and we can win in this scheme. If everybody that has some leverage adopts 10%, before you know, we'll cover this health scheme. I would say Bayelsa State Primary Healthcare Services or facilities, as the case may be, is the biggest beneficiary for this investment for today, because almost all the persons enrolled are enrolled into the primary healthcare space. The beauty of that, it means that more persons will now be asking for healthcare in the facilities, so healthcare workers will now be up and about, up and doing, to make sure they provide those services. And essentially, it will be the best thing to happen to us. Once we fix primary healthcare, I think we can fix the country.
My name is Dr. Ismail Ahmed. I'm a health specialist with UNICEF in the country office in Abuja. And it's a pleasure for me to be in Yenagua to witness this groundbreaking activity. I must say it's quite impressive, and we in UNICEF, we are proud of our collaboration with Bayelsa State Health Team, specifically the Bayelsa State Primary Healthcare Development Agency and the Bayelsa State Health Insurance Scheme. Now, in this groundbreaking, where UNICEF, with the support of GAVI, have enrolled about 10,000 vulnerable women and children into the healthcare scheme, is very wonderful. And having been here and had a lot of wonderful things the insurance scheme in Bayelsa is doing, is quite reassuring that at least all is not gloom and all is not doom. That if the other states can learn from the wonderful stride Bayelsans have been doing, I think we are going to have a lot of positive stride in the healthcare system. Work very hard to improve the lives of women and children in Nigeria. And finally, as I've said before, it will be good if other states will come to Bayelsa for learning tours, to be able to interact, share learnings, and be able to see how they can improve their system as well. Thank you.
Now, can you kindly tell us if there have been similar initiatives in other regions or countries around the world, and how has the success story been so far?
I'm Dr. Ege Abi, Health Specialist, UNICEF, Rivers Field Office. In some other countries we have done similar initiatives, but but this is the first that we are doing in this part of the country, and Bayelsa is number 1. And the idea is that we want to get our women, the pregnant women, women of childbearing age, and children under 5, which is our mandate, to have access, to have the reach for health. And we know that when we do this, we will reduce the out-of-pocket expenses, which is also trying to contribute to our universal health coverage to the states, achieving the universal health coverage. And even in this, even in increasing access, we have also tried to see that many of our health facilities in the states have been renovated to increase access and reach, providing boats to help in getting our vulnerable, especially those in the river areas, to the PHIS. So are some of the areas that we have tried in supporting the state government. And we know that when we do this, it will improve health outcomes, which is the ultimate.
Well, this is one of the most profound events that are happening in Bayelsa Health Insurance Scheme. And through Bayelsa Health Insurance Scheme, a lot of people in Bayelsa are having the opportunity to have access to quality healthcare services in Bayelsa State. And that is a wonderful thing, in line with our mandate of getting health insurance to every resident of Bayelsa State. And this is a step forward.
BHIS, committed to your health needs.